Hey everyone, and welcome back for another deep dive.
Hey there.
Today we're going to be looking at diabetes and complications from diabetes.
Yeah, that's good.
We got a really great video from my YouTube channel, MedVarsity Online Limited, and the title is Managing Cardiovascular Risks in Diabetes with a Pipe, and then medical case discussion.
Oh, okay.
So we're going to be looking at this video and kind of picking out some of the highlights, some of the things that we thought were really important for you guys to know about this topic.
Yeah, and it really jumps right into things.
Yeah, it really does. It jumps right into talking about diabetic emergencies.
Right, and so you can imagine, like, you wake up and you're just feeling super thirsty, right? And you have to keep going to the bathroom all the time, and maybe you're feeling a little nauseous.
Yeah, and you just don't feel right.
Yeah, like, could this be a diabetic emergency?
It very well could be.
Right.
So the video talks about these three main diabetic emergencies that you should really look out for, and those are diabetic ketoacidosis, DKA, hyperosmolar hyperglycemic state, or HHS, and then the third one is hypoglycemia.
Yeah, and these are all kind of surrounding that blood sugar imbalance, right?
Yeah, blood sugar is really the key here.
Yeah, but there's some important differences between them.
Right.
So, like, DKA, you see this a lot with type 1 diabetes, and it's kind of like your body's hitting that panic button because it can't use sugar for energy, right? Because there's not enough insulin there.
Right, it doesn't have that key.
Yeah, so it has to get energy from somewhere, so it starts burning fat.
Right.
But then that creates a buildup of these acids called ketones.
Okay, so it's like it's going into overdrive, it's trying to find energy from somewhere, and it's creating these ketones.
Exactly.
Okay, so what about HHS? What's that one all about?
So HHS, this is something that you see a lot with type 2 diabetes.
Okay.
And it's more like your blood sugar levels just going through the roof.
Okay.
But you don't have, like, those ketone alarm bells going off.
Gotcha.
It's more of a slower burn,
Yeah.
but it can be just as dangerous if you don't treat it.
Right. Yeah, you don't want to ignore it.
Right. And then you have hypoglycemia, which is kind of the opposite problem, right?
Right.
It's like this sudden drop in blood sugar.
Yeah.
And this can happen to anybody with diabetes.
Yeah.
Especially if they're taking insulin.
Right. Yeah.
So it's important to be aware of that.
Yeah. So that was a lot of information. But the video does a really good job of explaining the warning signs for each of these emergencies.
Right.
So for DKA, you're going to have like a really intense thirst. You're going to be urinating a lot. You could have nausea. You could even have difficulty breathing.
That could be pretty scary.
And HHS can be a little sneakier.
Right.
You might have some confusion, some neurological changes along with those kind of early symptoms that we talked about.
Right.
And then with hypoglycemia, you're going to feel like you just suddenly lose all of your energy.
Yeah.
You could have shakiness, sweating, anxiety, dizziness. So if you're experiencing any of these symptoms, please seek medical attention immediately.
Yeah, don't wait on that.
Don't wait. Yeah.
Yeah, and it's important to realize, like, these emergencies aren't just about, like, feeling a little unwell.
Right.
They can have really long-lasting consequences if you don't address them quickly.
Right. So you really got to stay on top of it.
Yeah, absolutely.
So we've talked about those immediate threats. Now, what about the long-term complications of poorly managed diabetes?
Right.
You know, you really want to stay ahead of these things.
Yeah, for sure. And the video does a good job of kind of categorizing them into macrovascular and microvascular complications.
Okay, so what does that mean?
So basically, those are problems with, like, your big blood vessels and your small blood vessels.
Okay.
And we can start with the macrovascular complications.
Okay, so those are like the heavy hitters.
Yeah, exactly.
And this is where we get into like cardiovascular disease.
Right, and it can get really serious.
It can get really serious.
Yeah, so one statistic that really kind of jumped out at me was that people with diabetes, they face a 4 times higher risk of having a heart attack compared to people who don't.
Oh, wow. That's a big difference.
Yeah, it's pretty shocking, right?
Yeah, that's really scary.
It
So
is.
the video gets into like why that is, why do people with diabetes have that increased risk? And it's like this whole chain reaction in your body.
Yeah, it's like high blood sugar just kind of sets everything off.
Right. It's like a domino effect.
Exactly.
So first you have dyslipidemia,
Right.
which basically means that your cholesterol and triglycerides are out of whack.
Yeah, those fats in your blood,
Yeah.
they're just not where they should be.
Right. So then the lining of your blood vessels starts to malfunction.
Yeah, it's called the endothelium.
Yeah.
And that's like the inner lining.
Oh, okay.
And when that starts to malfunction, it paves the way for that plaque buildup.
Right.
And that's when you start seeing that atherosclerosis.
Okay, so is that the hardening of the arteries?
Yeah, the narrowing and hardening of the arteries.
Okay, and that can lead to heart attacks and strokes. Right, so that's a big one.
Yeah.
But the video doesn't stop there.
It doesn't.
It also highlights how diabetes can impact your heart's tiny blood vessels and the nerves in your heart,
Right.
which further increases the risk of cardiovascular problems.
Mm-hmm.
So it's really a whole body condition.
It is.
It's not just about blood sugar.
Yeah, it's not just like one thing, it's everything.
Yeah, so we've talked about like those big picture issues, the macrovascular stuff. Now, what about the microvascular complications, the ones that affect those smaller blood vessels?
Right. Well, the video starts with diabetic nephropathy,
Okay.
which affects your kidneys.
The kidneys, okay, so this is where we start seeing those long-term effects of high blood sugar.
Exactly. And it's not just about feeling sick or anything like that.
Yeah.
This is like a leading cause of kidney failure globally.
Wow. Okay.
Yeah, and it's because that high blood sugar along with high blood pressure, remember that dyslipidemia we talked about,
Yeah.
that can damage those tiny little filters in your kidneys.
Oh, wow. So they're not filtering properly.
Yeah, exactly. And over time, they just lose their ability to clean your blood.
Okay.
And so then waste products start building up.
So the video kind of talks about how this progresses in stages.
Right.
And eventually you get to a point where you might need dialysis or even a kidney transplant.
Yeah, it could be pretty serious.
That's really scary.
Yeah, it is.
So that's why catching it early is so important.
Right.
So early detection is key.
It is. And it's fascinating because early detection can really change the course of this whole disease.
Really?
Yeah. And so the video highlights this thing called microalbuminuria testing.
Okay, so what is that?
So it's this simple urine test,
Okay.
and it can pick up on even tiny amounts of protein in your urine,
Okay.
which is a sign that your kidneys aren't working as well as they should be.
So it's like a warning sign.
Yeah, it's like a little red flag.
Okay. I like that analogy.
Yeah,
So you're getting that warning before it becomes a really big problem.
exactly.
Okay, so we've talked about kidneys. What about our vision? What about our eyes?
Yeah, so that's where diabetic retinopathy comes in.
Okay.
And the video stresses that this is actually a leading cause of blindness in adults.
Wow. Okay.
And it's similar to nephropathy,
Okay.
where it's
Yeah.
all about damage to those tiny blood vessels.
Mm-hmm.
But this time, it's in your retina, the part of your eye that captures light.
Okay.
And that high blood sugar can just disrupt the blood flow.
Yeah.
And that can lead to vision problems.
And potentially blindness?
Yeah, if it's not taken care of.
Wow.
Yeah. So the video walks us through the different stages of retinopathy,
Okay.
starting with like mild swelling and some leakage in those blood vessels.
Mm-hmm.
Then it progresses to more severe blockages, bleeding.
Yeah.
And then it can even get to a point where you have these abnormal blood vessels growing,
Wow.
which can further threaten your vision.
Okay, so regular eye exams are super important for anyone with diabetes.
Absolutely. Cannot stress that enough.
Right.
Yeah.
So how can people take control? You know, how can they prevent these complications
Right.
from even happening in the first place?
Yeah, well, that's where the video's focus on management and prevention comes in.
Okay.
It's all about shifting from understanding the risks
Right.
to actually empowering ourselves to take charge of our health.
So before we jump into how to manage and prevent these complications,
Right.
I think it's important to circle back to those diabetic emergencies that we talked about earlier,
Mm-hmm.
because the video actually does more than just, you know, tell you the symptoms.
Mhm.
It actually gives you a really practical guide for how to handle them.
Yeah.
So let's say someone's experiencing DKA. What are the key steps that they need to take?
Well, the video breaks it down really nicely.
Okay.
First and foremost, intravenous fluids.
Okay.
Those are super important to
Yeah.
rehydrate the body.
Yeah, it's like watering a plant.
Exactly.
That's dried out.
Yeah, you got to get that fluid back in there.
Okay. And then insulin therapy to bring down those blood sugar levels.
Right.
So that's kind of the 1-2 punch.
It is. But there's a little caveat there.
Okay.
They actually emphasize that you really need to start the insulin therapy after you've given adequate fluids,
Okay.
especially if the person has any heart conditions,
Okay.
because you don't want to cause a sudden drop in blood pressure.
Gotcha. Okay. So the timing is really important.
Yeah, it's all about the sequence of events.
So what about HHS? Is it kind of a similar approach?
It's very similar.
Okay.
You're still going to use those fluid replacements, insulin therapy, electrolyte correction.
Okay.
But there's a really important thing to remember here.
Okay.
If you bring down the blood sugar level too quickly,
Yeah.
that can actually be dangerous.
Oh, wow.
Yeah, you can cause swelling in the brain.
Okay.
So you really need to have a gradual controlled reduction in that blood sugar.
Yeah, it's like a delicate balance.
It
Okay, so the video also mentions some other potential issues that can arise from DKA and HHS.
Right.
Like, low potassium, low phosphate levels,
Yeah.
even fluid in the lungs, low blood sugar as a counter reaction. So it really emphasizes that you need to be monitoring
Yes. Clothes monitoring is super important.
during treatment.
Absolutely.
Yeah. Okay, so let's shift gears to hypoglycemia.
Okay.
So remember, that's the rapid drop in blood sugar.
Right.
And the video gives us a really clear roadmap for how to address it.
Yeah.
Whether you're the one experiencing it or you're helping someone else who's going through it. And it's not always about like medication overdoses.
Right.
Some people think that's the only reason it happens.
Yeah.
But really, it could be missing meals. It could be intense exercise. Even infections can throw off your blood sugar.
You can.
So being aware of those symptoms is really crucial.
It is, and the video outlines them really nicely.
Yeah.
It starts with like those subtle signs like sweating and shakiness, but then it can progress to more alarming things like confusion and seizures.
Okay, so what do you do if you're experiencing those early symptoms?
Well, if you're conscious
Yeah.
and you're able to swallow,
Right.
you just need a quick boost of sugar.
Okay, so like glucose, tablets, juice.
Yeah. Anything that'll get that blood sugar back up.
So what are some of the key lifestyle changes?
Well, the video breaks it down into these 4 main areas.
Right.
Diet, exercise,
Mm-hmm.
weight management,
Yeah,
and, of course, quitting smoking.
right. Get rid of those cigarettes.
Yeah.
So let's start with diet. What are the key takeaways there?
It's all about focusing on those whole, unprocessed foods.
Okay, so like fruits and vegetables and
He's sad.
whole grains.
Yeah, think like vibrant, colorful fruits and vegetables,
Yeah.
fiber-rich whole grains,
Mhm.
lean protein sources.
So you're kind of like fueling your body with premium ingredients.
Yeah, exactly.
Okay, what about exercise? How does that fit into the picture?
So the video recommends at least 150 minutes of moderate intensity aerobic exercise
Okay.
every week.
So that's like brisk walking.
Yeah, brisk walking, swimming, dancing,
Okay.
anything that gets your heart rate up.
Mm-hmm.
And you don't have to do it all at once.
Right.
You can break it up into smaller chunks
Okay.
throughout the day.
So that makes it a little bit easier
It does.
to fit into your schedule.
Yeah, for sure.
What if someone's really out of shape?
Well, the video really emphasizes that it's never too late to start.
Okay.
And even small changes can make a really big difference.
Right.
So find activities that you actually enjoy
Yeah.
and gradually increase that activity level.
And be consistent.
Yes, consistency is key.
And it's not just about preventing those complications.
Right.
Exercise can actually help improve your blood sugar control,
Exactly.
lower your blood pressure,
Yeah.
and even boost your mood.
It's like a win-win all around.
Yeah, for sure.
Yeah.
So what about weight management?
Yeah, that's a tough one.
Yeah, it can be a really sensitive topic.
It is, but the video addresses it head on.
Okay.
It emphasizes that even a small amount of weight loss,
Okay.
like 5 to 10% of your body weight,
Mm-hmm.
can have a significant positive impact.
On your health.
Yeah, on your health.
So it's not about being like super skinny.
No, it's about making sustainable changes
Right.
that support your overall well-being.
Okay.
Yeah,
So it's about progress, not perfection.
exactly.
And let's not forget about smoking.
Right.
That's a big one.
Yeah, the video clearly identifies that as a major risk factor.
For a whole host of complications.
Pretty much all of them.
So if you're smoking, try to quit.
Yeah, it's one of the best things you can do for your health.
Yeah, it's like giving your body a fresh start.
I like that.
So we've covered a lot of ground in this deep dive.
We have.
What are some of the key takeaways that you hope our listeners will remember?
For me, the biggest one is that diabetes is serious, but it doesn't have to define your life.
Right.
With early detection, proactive management, and a commitment to those healthy lifestyle changes,
Yeah.
you can dramatically reduce your risk.
Of complications.
Yeah,
And live a long and healthy life.
exactly. You can still live a fulfilling life.
Absolutely.
It's not a death sentence.
Yeah. And I think the video does a really good job of empowering people
It's
to take control of their health.
Yeah, it's not just about relying on your doctor or medications.
Right.
It's about making informed choices
Right.
and taking those daily actions.
That can really make a difference.
Yeah, you have the power.
Exactly.
So thanks for joining us for this deep dive.
Yeah. Thanks for listening.
And we'll see you next time.
See you then.